a lot of times injuries can be seen as an opportunity. So we have to stop doing certain things, or we have to do them less, or we have to modify them. But there are other things that aren't going to cause pain and aren't going to aggravate the injury. And a lot of times that's skill-based. So here's an interesting thing. If you get injured, and let's say you've got 6 months to recover to get back to playing how you want to play, that's 6 months of skill development that you can get in because you have extra time and energy now. So you can actually come out of an injury a better at the sport, and sometimes better athletically, because you can work on other things maybe you didn't have time or energy to do. For this episode, I'm going to talk about a couple different patient cases. This is going to be helpful for anyone who has chronic pain that seems to come out of nowhere and maybe fluctuates. So maybe it changes locations sporadically, or it shifts in pain levels, and you've struggled to pin down the cause or the source of the pain, and you're not really sure what to do next. So this was a conversation I had. Actually, this wasn't a patient of mine, but I think it's an interesting case because this happens to a lot of people. So this person, she is a recreational tennis player. I think she plays multiple times per week, so let's say 3-4 times per week. And she's been having low back pain and hip pain. And the two are not always connected. So you could have hip pain without low back pain. You could have low back pain without hip pain. I think sometimes they can happen at the same time, and sometimes they'll shift. So it'll start with one and it'll go to the other. And it doesn't seem to be very predictable. So this person she got rehab and went through physical therapy for a while, wasn't getting results, tried chiropractic care, wasn't getting results. And when I say wasn't getting results, it's not that she didn't get any relief, because she did. So there would be a very particular pattern. She would go either to the chiropractor or the physical therapist. She would receive therapy. And then she'd feel better. When I say therapy, this could be anything. So this could be soft tissue therapy, manipulations, so chiropractic adjustments, joint mobilizations, rehab, exercise therapy, probably some passive modalities. I'm not quite sure. Maybe some E-stim, laser, things like that. So she's had a lot of different things, and typically she'll go into a session, a clinical session, and she'll come out and she'll feel better for a short period of time, and then go back to tennis, and the pain would come back. So at some point in this whole journey, she had imaging. So I would imagine they started with x-rays and then moved on to the MRI. MRI showed some findings. So she had a disc problem somewhere, disc herniation or something that showed up on imaging. She also had some narrowing of some joint spaces in the spine. So typically what happens, if you've got pain that you can't figure out, and then you do imaging, we automatically think, well, that imaging finding must be the source of pain. And it can be. Or even if it's not the primary source, it definitely can be a contributing factor. I think that there tends to be, how do I say this? There tends to be this knee-jerk reaction to just blame the pain on the imaging findings, when we know that a lot of times is not actually what's causing the pain. Because if you think about disc problems and joint space narrowing, if we took 1,000 people who don't have any low back pain or hip pain and we imaged them, we'd probably find disc herniations and joint space narrowing. And the same thing on the flip side, really, if you took 1,000 people who have pain in those areas, you're going to have clean imaging findings. So we can't necessarily say that the imaging findings are conclusively causing the pain, because feasibly we could, for the disc problem, those can heal, and a lot of times those do heal quickly, and then the pain persists. And also, if there's joint space narrowing, there's not a lot we can do about that. So even if you're going to say, well, the loss of joint space between the discs or the segments or whatever joint you're looking at, that's the cause. Well, you can't That is a process that the body goes through, and we can't necessarily reverse that. So you have to find a way around that or a way through that. And there are a lot of things that we can do. So I think that's the problem with jumping to imaging. It's not a bad idea if you're not getting, if you've exhausted a lot of other things and there's no trauma. Yeah, you can go to imaging. But anyway, this young lady had the imaging. So now she's thinking, okay, I've got a disc problem and I've got some joint space problems. Still not getting the results that she wants, and it's very, very confused. So where I come into the conversation is more of just, it was just a casual conversation, more of a, not even a doctor-patient relationship. So just like, oh, what do you think about this? So I was going to give my 2 cents on it. So some questions that I had initially was, is the pain more related to the actual playing of tennis, so striking the ball with the racket, or is it related to sprinting and cutting? And that was a question that hadn't been asked yet. And that's an important question, because if it's not related to sprinting, so she can go out for an hour and run sprints and not have any hip or low back pain, then maybe she needs a tennis coach to start to work on technique. Maybe it's that simple. If it is not related to tennis, so if she's not sprinting, but she's doing technique drills, everything's fine. But then as soon as she starts sprinting and she fatigues and the pain starts, well, then it's a strength and conditioning problem. Now, more than likely, it's a combo of both. But we would want to see what is the low-hanging fruit, which is the best thing to address first. And I would imagine that you probably need to address both at some point. But the strength and conditioning one, more than likely, has a lot to do with it. Because you got to think, if you go out and you've got an injury, so you've got a disc injury and you've got some joint pain, and you feel okay, you warm up and you start playing, and then you fatigue. Well, as you start to fatigue, because your strength and conditioning is not at a level to allow you to play for as long as you want, as hard as you want, then it's not a stretch to think that that's when you're going to start to feel the pain. So that was an important thing. And I think if you're listening to this and this is kind of sounding like you, maybe you don't play tennis, but you do something else, you can start to think about this critically. Well, what is the larger contributor? Is it a technique thing, or is it a strength and conditioning thing? Is it a fitness thing? And, for recreational athletes, a lot of times the strength and conditioning lacks. So maybe you've played some sport or you've done something at a relatively high level when you were younger and you had more time to put in it, and now you're aging and you're just not putting in the same amount of time, but you want to go out and play and perform at the same level. Your body just doesn't work like that. So, and a lot of times also with recreational sports, there's no preseason. And that's rough. So I played sports in college, and preseasons were terrible. They were really hard. It was a relatively short, 3 weeks, maybe a month, intense, harder than what you would experience in competition, ideally. Or you would at least ramp up to that. And that was the whole point, to make sure that you were ready to compete at a high level. If you're not on an organized team with some financial backing, a lot of times you just don't get that preseason. And that's hard for people. I noticed that with club sports at the college level. Varsity sports will have preseason, club sports won't. But club sports can be relatively competitive also. So you'll get a lot of athletes that come in and they haven't had a preseason, and all of a sudden they start training twice a day, and then within a week they're playing games, and then you see all these injuries. So let's go back to this. This is an interesting thing. Also, I wanted to know, for this tennis player, how long into playing does the pain typically start? And it can be different, because sometimes this person will go out and she'll play and she'll have low back pain, and then sometimes she'll have hip pain. So is there, for the low back pain and then for the hip pain, is there a specific amount of time into a tennis match when she starts to feel the pain? And that question had been asked, and the answer that I got was roughly about halfway through. So that's an interesting thing too. So this is something you could feasibly have the tennis player do, or the athlete do, is why don't you go get a good warm up and you play for enough time to actually get in and enjoy the sport, but you cut the time limit back. So you want to play at a certain intensity because that's fun. And typically maybe you like to play for 2 hours, but maybe we only play for like 45 minutes to make sure that you're able to recover and that the pain doesn't go up. And then we progressively maybe add more time back in. Or we let you play for the 2 hours and maybe it's more related to intensity, but you don't go hard, or you take more breaks. And basically we try and set a comfortable baseline. And this is something that hadn't been done yet. And here's an analogy that I like to use for things like this. Let's say I get a rash on my arm and it itches a lot. So I'm scratching it constantly. And I scratch it so much, the rash doesn't go away. And now it opens up as like it's a sore. It's bleeding a little bit and it starts to get infected. So I go to a dermatologist. The dermatologist looks at it. And in the clinic, the dermatologist is going to provide therapy. I think you can already see how this comparison works. They're going to clean the wound. They'll probably apply some type of cream or something to help with the itching. And then they're going to help with the infection. So they'll put something else on it. Maybe there's one therapy that'll do both. A lot of times there is. And then they will bandage it up and they will give me instructions. And then they're going to give me about a certain amount of time it's going to take for this to heal. And as I leave that therapy session with the dermatologist, my hand will feel better. But at some point, it's going to start to itch again. And let's say as soon as it does, I go back in aggressively and I just start itching, or I start scratching the itch again. Well, what's going to happen? It's going to go back the way it was. It's going to get painful again. It'll start to bleed again. It may get infected again. So then let's say I go back to the dermatologist and I say, look at my hand. So he goes back and he applies the therapy again. Again, it feels better at the end. I go and then I just go back to my daily life and I start scratching it again. And we just go back and forth. Now, is anyone going to think that the dermatologist isn't doing what he or she is supposed to be doing? No, they're doing a great thing. They're doing exactly what they need to do to treat that. But I'm not holding up my end of the bargain when I'm not in the clinic because I just go back to scratching it. So I like this analogy because I think it makes it very clear that when you're not in the clinic, you do have to sometimes modify your activity to help augment the treatment that you're getting in the clinic. Now, based on everything that I had heard treatment-wise and therapy-wise for this tennis player, I don't disagree with any of it. I think everything clinically was probably great. It all sounded fine to me. I think a big problem this player was having is that she would have pain. She would go to the clinic, whether it's chiropractic or PT. They would spend time helping her and working on her. She would feel better, and then she would just go back out and play tennis as she normally would because she felt better. And so she just basically went and scratched that itch and opened that wound again over and over and over again. I don't want to make it sound like she was injuring her disc every time. I think the analogy works not in the sense of tissue damage, but if you're thinking about just the habit. So this is something that had not been communicated to the tennis player, as far as I could tell, was that you need to modify things, at least for a short period of time. Now, I hate telling athletes to rest. I think that's the worst thing, one of the worst things we can do. Maybe for a couple days, but if she loves tennis and she loves the sport and she wants to get back there, there's a lot that we can do. So instead of rest, I might call it active recovery. So maybe psychologically for her, she wants to get out and she still wants to go out and play for 2 hours, 4 times a week. Yeah, I think maybe this is tied to like a friend group and different things like that. So I don't want to pull her away from that lifestyle. I don't want to pull her away from the friend group. I don't want to pull her away from the schedule that she likes to keep. So if that's the case, let's get her out there 4 times a week, like she likes, for a couple hours. But let's modify stuff. So maybe we can get her to do an hour warm up that involves a lot of technique. We could find something that she's not good at. Maybe she's not good at backhand with the left hand, or I don't know. I don't know much about tennis, but there's got to be some type of skill thing that she can work on, because a lot of times injuries can be seen as an opportunity. So we have to stop doing certain things, or we have to do them less, or we have to modify them. But there are other things that aren't going to cause pain and aren't going to aggravate the injury. And a lot of times that's skill based. So here's an interesting thing. If you get injured, and let's say you've got 6 months to recover to get back to playing how you wanted to play, well, that's 6 months of skill development that you can get in, because you have extra time and energy now. So you can actually come out of an injury a better at the sport, and sometimes better athletically, because you can work on other things maybe you didn't have time or energy to do. So that's how I would look at it. Let's say she feels confident she can play 30 to 45 minutes at the pace she wants to without aggravating pain. Awesome. So we'll make that the last little bit. And then initially it's a long warm up with a bunch of skill development. Maybe she doesn't feel like she can do that at all. Maybe, if she goes at full intensity at any point, it's going to provoke pain. Okay, well, let's get you out there 2 hours, 4 times a week like you want. And let's dial back the intensity and develop skills. Now, that's not going to be as much fun, but most people are reasonable, and they would understand this process, and they would appreciate the fact that they still get to hang out with their friends, they still get to play their sport, they still get to keep their schedule, they still get to be active, and they still get to have some type of enjoyment, and they're going to possibly come out of this a better athlete or better at the sport. And to take it out of tennis, I use this all the time. So I had let's say you have a right-handed basketball player who's got right elbow pain. Well, how good are you at shooting with your left hand? How good are you dribbling with your left hand? How good are you at doing layups with your left hand? Why don't we practice that? So this elbow thing, whatever it is, let's say it takes 6 months to get you back to what you want to do. Well, you could be great with your left hand in 6 months if you really put in the time. So we can keep you in training, we can keep you having fun, we can keep you with your team, and help you feel like you're actually progressing in the sport. For people who blow out an ACL, most sports have some type of upper body component to them. So we can make you more robust, strength and conditioning wise, in your upper body. There's just a lot of stuff that you can do with an athlete, whether it's a competitive athlete, a recreational athlete, or it's just an active person, that can keep them engaged in the activity that they love as they're actively working back. And actually, when they come out of an injury, in many ways, they could be better at that sport or at that activity than they were before the injury. So the injury can be an opportunity. That's another direction that had not been, another possibility that had not been communicated to the athlete. So that was a recommendation that I had. And here's another example. This is actually is a patient of mine. He plays pickleball, and really into pickleball, so similar than tennis. And it's kind of weird how these things come up. So I had this other conversation about the tennis player, and then I did a follow-up with one of my patients who's technically now a former patient, a pickleball player, and he was not having low back and hip pain, he was having knee pain. So when he came in, I examined the knee as I would. So I took a full health history. We did a focus history on the knee. And then I did a thorough orthopedic exam, neurologic exam, movement analysis. And by that, I just watching him walk around with something fancy and squat and move and do some athletic things. And I think at the end of it, I don't know what the exact diagnosis was. It was the best. I mean, he had probably had some type of tendon problem. And it wasn't really that bad, but I think it could get worse. And so I was talking to him about his sport, because pickleball isn't necessarily for most people, the most organized thing, although this guy was pretty competitive at it, or at least he played a lot. So I said, what kind of warm-up do you do? And he doesn't really have one. He just kind of goes out and starts playing and gets into it. And so I said, well, I wonder what would happen if you took 20 minutes to warm up. And so we got on YouTube together and we just started looking at pickleball warm-ups and tennis warm-ups until we found a video that seemed to work well for him. And I said, okay, why don't you go out and do that? And then he also didn't have any strength and conditioning. So going back to the idea that there's no preseason for this, well, why don't we blend in some strength and conditioning? And I didn't have time to do that with him, and I don't really think he needed me. So I connected him with a strength and conditioning coach who I refer to a lot, and she started working with him. And I had a 1 month follow-up. I think we'd connected via phone or text or something, and he had been doing well. And we had a 1 month follow-up. So I was talking to him recently, the other day, and he was like, it's crazy. I go out there and I do a good 20-minute warm-up, and I still have a little bit of knee pain, but it's not that bad. And then it doesn't really bother me after. So it's almost like the warm-up kind of fixed it. And so he didn't really need a whole lot. And I asked him about the strength and conditioning if he had been doing it, and he said it's kind of weird because the first hard training session he did with the strength and conditioning coach there was a lot of legs involved. And he thought his knee was going to be in so much pain, even though the knee didn't hurt during the training. And he said the next day was the first day in a long time where he had zero knee pain. He had a lot of muscle soreness, but no knee pain. And I think this is interesting because this is someone who reported to a healthcare provider to solve a problem when he didn't need a healthcare provider. He needed some basic strength and conditioning, and he needed a warm up for his sport. So I think sometimes I get it as a patient or a person, even as a healthcare provider, it's hard when you're trying to analyze yourself and what's going on. The interesting thing that it is not uncommon for me or for someone in my position to step back and look at the big picture and see some very low-hanging fruit, some stuff that very obviously is probably going to have an effect. It might not fix the problem because I think this guy still has a tendon problem, but he's able to keep playing and he doesn't really need healthcare. And I would imagine that from what I know of the strength and conditioning coach who I refer to, the tendon is going to improve. It's going to get better. He's going to get stronger. Everything's going to work out for him. So I like these two examples because I think they're common, or at least the patterns are common. And I think that people who struggle with these types of things, a lot of times as an individual, you can't step back and see the bigger picture, and you can't recognize the big gaps. You can't see the low-hanging fruit. And we're looking for a more complex solution because the problem seems very complex. And I don't want to make light of it and say that it's not, because usually these problems are complex. It's not just tissue damage. It has to do with lifestyle, and has to do with social aspects, and it has to do with the way your mind perceives the injury or the pain. It has to do with your fears and your concerns. For a lot of people, it has to do with sleep and maybe anxiety and stress, and it has to do with nutrition. And this can and usually is complex, but the low-hanging fruit for a lot of people it's not complex. It's just hard to see when it's yourself. And because of the complexity of some of these injuries and some of this pain, I don't think that fixing it, air quotes, fixing it, is ever even necessarily a possibility. Because it's extremely likely if you have pain or an injury that it's going to come back again. So if we take the expectation of fixing something off the table, and we just say it's probably not a possibility, then we can ask some really important questions. Well, how good can I get and how long is it going to take? That's prognosis. So we don't worry about the diagnosis as much. It's still important, especially ruling out some serious stuff, because sometimes someone can tear something or break something, or they've got some type of tumor, or some of these things can happen, and they present as simple problems with simple solutions, but they're not. It's a little bit more, it requires more treatment. So we want to make sure we screen for those things, which is why I screen for pretty diligently with most people. But once we're not worried about all that serious stuff, for a lot of these things, we do need to acknowledge that it's probably not going to ever be fixed. It'll probably always be there to a certain extent, or it's going to come back. So then we ask that question, how good can we get, how long it's going to take, and what do we need to do? And what do we need to do in the meantime to keep us doing the fun stuff and the important stuff? And so I think that's where, good quality healthcare providers, regardless of the letters after their name, can be really valuable. And sometimes it doesn't take a healthcare provider, a good strength and conditioning coach, or just a good coach. Sometimes sport coaches can see these things. Although it is hard. I think it's hard for a sport coach because they're so much focused on performance that it's even hard for them to step back. So it can be easier for those of us, like a healthcare provider or a strength and conditioning coach, who is not actively attached to the activity, to be able to step back and see the bigger picture. All right. Well, that's all I have for this episode. I hope this was helpful, and thanks for listening.